Hello everyone, my name is Mary Yvonne Seraspe and today my groupmates and I will discuss about malaria. And these are the contents of our report, the definition, pathophysiology, diagnostic procedure, treatment, and nursing care. Now, what is malaria? Malaria is a mosquito-borne disease caused by a parasite, and the causative agents are Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malariae. And P. falciparum is the most fatal and most common in the Philippines. Now, for the pathophysiology, the parasite is spread to humans through mosquito bites, most specifically infected mosquitoes, an infective female Anopheles mosquito. Now, how can you get malaria? So as you can see in the picture, malaria spreads when a mosquito becomes infected with the disease after biting an infected person, and the infected mosquito then bites a non-infected person. The malaria parasites enter the person's bloodstream and travel to the liver, which makes the liver becomes infected. Then the parasites will mature and they leave the liver and infect red blood cells. Now, when your RBCs are infected, they will manifest pathognomonic signs, and these are fever, which is in the hot stage, severe recurrent chills, which is in the cold stage, and profuse sweating, which is in the wet stage. And all of these are associated with the rupture of the red blood cells. Now, when you are infected with malaria, you will be incubated for 1 to 4 weeks, but sometimes more than a year.
Hi, my name is Mabel Dominic Guzman and I'll be discussing the diagnostic procedure and treatment for malaria. So for the diagnostic procedure, your doctor will likely review your medical history and recent travel, conduct a physical exam, and order blood tests. If malaria is diagnosed and treated early, it can usually be cured, but if it is left untreated, malaria can lead to life-threatening complications including kidney failure, liver failure, and internal bleeding. So if an infection is suspected, your blood will be tested to check for signs of a malaria infection. Your blood sample may be tested in one or both of the following ways. First is the blood smear test. In a blood smear, a drop of blood is put on a specially treated slide, and the laboratory professional will examine the slide under a microscope and look for parasites. A normal test is negative, meaning that you don't have any Plasmodium parasites in your blood, and a positive result means that you have the parasites in your blood and that you may have malaria. And then next is the rapid diagnostic test. This test looks for proteins known as antigens, which are released by malaria parasites, and it can provide faster results than a blood smear, but a blood smear is usually needed to confirm a diagnosis. Then, if your results were positive, your healthcare provider will prescribe medicine to treat the disease. The type of medicine will depend on your age, how serious your malaria symptoms are, and whether you are pregnant. And the most common anti-malarial drugs include chloroquine phosphate. So chloroquine phosphate is also used to treat amoebiasis. It works by killing the organisms that cause malaria and amoebiasis. And then next is the artemisinin-based combination therapies or ACTs. So these are the first-line therapy in almost all countries where malaria is endemic due to the high efficacy, tolerability, and ability of ACTs to reduce ongoing transmission of the parasite. And ACTs are comprised of two components, an artemisinin derivative and a partner drug. Examples include artemether lumefantrine or Coartem and artesunate mefloquine. Other common anti-malaria drugs include atorvaquone propanil or Malarone. It works by interfering with the growth of parasites in the red blood cells of the human body. And then we have quinine sulfate with doxycycline, preventing the malaria parasite from being able to grow and killing it in the process. And then lastly is the primaquine phosphate. It prevents the development of the blood forms of the parasites, which are responsible for the relapse.
So hello everyone, I am Eliza Operaña and today I'll be discussing nursing care. So we have here three key points. First is to prevent infection, use of mosquito bed nets, protective clothing, insecticides or use of insect repellent on the exposed skin. Second is to reduce increase in and regain normal body temperature. Warm water compressed on the forehead and both axilla maintain warm environment. And third, improve fluid volume of the body, encourage increase in oral fluid intake, and administer prenatal fluids as ordered. So in conclusion, a good nursing care is essential in management of malaria, with particularly to prevent infection, attention and maintenance of normal body temp, and management of fluid balance. So that was the end of our reporting. Thank you for watching. I hope you learned something from our video. Bye!